Hello, and thank you for joining us on the Stay Healthy Knoxville podcast, brought to you by Simply Physio, aimed at helping you live an enjoyable, fit, and healthy life in and around our community of Knoxville, Tennessee. And now, here is your host, Dr. John Mark Chesney.
Hey guys, today on the show, we have Dr. Jameson Mattingly. So super excited about having him on the show. He is new to Knoxville, but brings a specialty to Knoxville that we'll be getting into. He's a true expert in his field. And he received his Bachelor's of Science from Western Kentucky University, and then received his medical degree from the University of Louisville School of Medicine in Kentucky. He was a resident in otolaryngology at the University of Colorado Health Sciences Center, and he completed his otology and neurotology fellowship at The Ohio State University, and then joined its faculty, and has recently relocated here to Knoxville, Tennessee, and joined the practice of ENT consultants of East Tennessee, where he specializes in otology and neurotology. So, Dr. Jameson Mattingly, welcome to Stay Healthy Knoxville.
Thanks for having me. It's a pleasure to be here.
Awesome. Well, I know the first question I usually ask is, tell us about a little bit of your backstory. But before we do that, we need a little bit of an explanation about your bio. So tell our listeners what is the field of otology and neurotology?
Yeah, no, it's not very many people know the actual name of it, but in basic sense, it's a specialist of the ear and the surrounding structures. But essentially what it is extra training off of an ear, nose, and throat or an otolaryngology residency that really specializes in complicated ear problems and complicated ear surgeries. And there's also a big neurological component to it. And that's why, you'll hear it potentially called neurotology. And that includes implants into the inner ear, things that restore, the sense of hearing or the sense of sound. And then tumors that live in the ear or that we access through the ear that are usually located in the brainstem or different parts of the brain. But I would say the majority of my specialty really takes care of, ear disease and complicated ear problems.
Yeah, I look forward to getting more into that topic. And going back to your past a bit, would love to hear just how you got into the field of specializing in the ear, but what brought you really to where you are today as far as getting into the field of medicine?
Really, it's kind of weird. As long as I can remember, I've always thought about being a physician. And, there were times where I didn't feel as confident about that over the years. But, from a very young age, I think that was something that was appealing to me because I was always very lucky in that I was good at science and math. And, that's a little bit of a prerequisite to getting into the medical field. I enjoyed biology and chemistry, and I liked just learning how different parts of biology work, whether that was plants or animals or whatever. And that was, really transitioned into college where I was a biology and chemistry major, and, those interests really got sparked by things like physiology and anatomy, so the structure and function of the body. And, if you're majoring in biology in college, you really don't have a lot of options what to do afterward unless you want to go to graduate school of some sort. And, that led me to medical school. And when I was in medical school, I was really drawn to, the anatomy of different parts of the body, particularly the head and neck. And that really transitioned into, where there was a couple specialties that dealt in the head and neck. And that was, ear, nose, and throat is probably the most prominent of those as far as we deal only in the head and neck. Got some good mentors. I knew I wanted to be a surgeon and saw some really cool cases in ear, nose, and throat in my first experience with it. And I was kind of hooked from there. From there, it gets a little bit more, into the weeds a little bit because neurotology or otology and neurotology can be definitely a very, a very small subspecialty of ENT. When I was in residency, I really liked about everything. The thing about the ear that I liked was that it was super difficult technically. We're dealing with really small spaces and some really important structures in that area. And, I don't think we realize, how impactful things like hearing loss and balance disorders and things like that can be on patients until you're really seeing these patients that are really struggling. I'll tell patients that I'm like, most people don't care about their ears until it's an issue. And so that combination of things, and then I got into some really cool research where I was actually looking at different implants and some of the technology that was, just really intriguing to me. And that led me, about halfway through my residency to say, I think this is something I want to do. It's a little bit more of a commitment. It's the longest fellowship in ear, nose, and throat. It's 2 extra years instead of just 1. And so then, went to Ohio State, got into their, to an awesome neurotology training. We did a lot of complicated stuff, a lot of cool patients, a lot of really, intense pathology where we were seeing a lot of people who were really disturbed by their problem. Initially I was really on this academic path where I was interested in doing a lot of research and publishing. And so I stayed on there. It was a really awesome environment for me to really get my feet wet, so to speak. And then, I kind of had a little bit of a change in career mindset where I really wanted to focus mostly on just taking care of patients. A lot of that academic stuff I have interest in, but really the bulk of my time I really want to spend taking care of patients. I feel like it's more natural to me. I like talking to patients. I'm an extrovert. I just like to be around people. And, that's what made this change come to here. And there's just not a lot of representation for people taking care of a lot of complex ears. There is some, but there's probably not enough for the population that we have in this area.
So you mentioned that otology and neurotology is a specialization of ENT, of the ENT field, right? Like a niche, a sub-niche. So are there other niches in ENT?
Yeah, there's several. The most common path is to be a comprehensive ear, nose, and throat doctor where they take care of basically it all. And that's just, you go through your 5-year residency and then you get out and you go to practice. And that, I think, that particular, I guess, area of ENT is where, the bulk of the heavy lifting comes for the most part. But outside of that, you can do specialties in head and neck cancer, voice or laryngology, voice and swallowing. You can do sleep. So, sleep apnea being, one of the most common, pediatrics, obviously otology and neurotology, facial plastics, and then rhinology is specialty in the sinuses. So really you can break it down to about any aspect of the head and neck or ENT that we deal with.
Like what percentage of people actually go into a sub niche of ENT, or is that majority of people kind of like your general physician of ENT?
I don't know the national numbers.
Yeah.
I know that at my residency program, it was probably 50-50 or 60-40, 60 being they went into, general ENT and 40% would do a fellowship. And, when I talk to other, colleagues across the country, I think it's very similar. There are programs where I think that there's more general ENTs that come out, and there's programs where there's more fellowship trained. So it's probably somewhere around 50-50, 60-40, somewhere in that ballpark. But there's a number of people who do a fellowship to some degree.
Now I understand too that your sub niche of otology and neurotology is like bringing something new to the Knoxville area, correct?
Yeah, relatively new. There are some other physicians, but just a couple who are doing ear-related stuff, complicated ear and implants. And, some of that is in pediatrics, some of that is both pediatrics and adult. There are people doing it, but it's underserved, I think. I think there's a lot more patients around this area that have these problems that either have to travel a long way or they may not be able to get all the care that they want because there's just not enough providers being able to do that locally.
Sure.
And traveling is a huge burden on patients, I'm sure you've heard this from your patients before.
Right. So before coming here in Knoxville, you were up at the University of Ohio State.
Definitely put "the" in front of it. I always feel weird saying that. So,
but yeah, so you were teaching, right?
I was teaching. So I was, I had an academic appointment. I was on the faculty there.
Okay.
Yeah, it was a fair amount different than what I'm doing now, for sure.
So tell us a little bit of what brings you to Knoxville. What attracted you to make the move? As of this recording, you're 6-7 weeks here,
yeah, something like that. About maybe 8. If we're lucky. Okay. A couple of different things. Some of it was luck. I knew one of the partners in the group that I joined reasonably well from interactions throughout residency and medical school. And, I had talked to him about, did the area actually need someone in this specialty? And the short answer was yes. And, based upon my own research in the area, there just seemed to be, like I said, it seemed to be an underserved area. And so that is by itself an appealing, scenario where I could come and be in an area where, just someone like me is needed. I mean, that's probably the number one reason. Second, I have family in Kentucky. It's closer to home even than we were in Ohio. And so that was kind of a draw. And then outside of that, really the outdoor scene, just the area, the weather, all that, all the above is really why we really were interested in this area. We lived in Denver for 5 years, loved the outdoor scene. It's, this is a fair amount different than Denver, but it has some similar aspects in that it's really close to like hiking and water and, really outdoor activities and things like that. So, a little bit of all those.
Sure. Yeah, that's I've spent just maybe a long weekend in Denver. So if you're comparing Knoxville to a little bit of Denver, I would say
it's definitely smaller, but it it's very, people are super nice and friendly, and you can get to some cool stuff in less than an hour. So that's kind of the way it was in Denver. I mean, there's Denver's just bigger. But it has an outdoor scene that we were really into, and so far we've fallen, in love fast with Knoxville. So
sure. Well, yeah. Welcome to Knoxville and to East Tennessee. So, going back, you were talking about some with your like specialty of surgical procedures, like of even like tumors or different pathology in the ear. That sounds. It sounds pretty complicated, to say the least, as far as I'm just, imagining doing, surgery. So oftentimes you'll go in through the ear to do surgery.
Yes.
Is that right?
It's in some aspect, either through the ear canal, or behind the ear. And that makes up basically 99% of the approaches I use to the ear. So we can make a lot of room further in. But it is a small area to work in. There's no question. And almost all of my surgery is done under a microscope for that reason. And that's another appealing thing about this field that I liked, is it was kind of cool working through a microscope and,
So you mean literally under a microscope?
Everything. Yeah.
Okay.
Yeah. So, if I go through your ear canal or behind your ear, I mean, I may spend, 90% of the surgery using a microscope, because it's just everything, it's just so much smaller. I mean, the eardrum itself is probably about the size of your index fingernail approximately. So, and that to me is the biggest structure that I work with. So it's that's why it's it's technically it's very challenging because of that, because the angles can be funny or difficult, or the anatomy, and like I said, is very more complex there and in a lot of places. So the combination of that all, which I am very biased, is why I love this field. So
yeah, I'm kind of stressed out just thinking about it, quite honestly.
Well, it takes a lot of training, and that's why you have to get very comfortable with it. And thankfully, I had really great training, good people around me who were really very helpful and allow me to understand some of this really complex area. And so it's less stressful the more you do, obviously, but it's very something I take every surgeon does, but something to take very seriously, and especially if you're working in small, tight areas. So
right is with as I see different fields going towards like robotic surgical procedures. Is that anything in your field or not? Really?
Not like some other some other parts of medicine where they're just working in bigger spaces. So a robot does actually take some space to get the instruments in, and right now the ear is just not big enough to allow that. I would expect over time that we would see some of that, and we are seeing some changes where we're using fancier microscopes or different microscopes or endoscopes where we actually we stick a camera in the ear and we operate with that. I would say that makes up a minority of what I do, but they're certainly changing. And I would say the biggest trend with our field is technology, from a hearing standpoint or things like that. It's just really advancing because, the technology is improving, but our understanding of how it all works with the brain and the ear is also improving, pretty rapidly. So
I've seen a number of surgical procedures that are more orthopedic in nature.
Well, that stresses me out. So there you go. Your job stresses me out. Someone coming in with like a knee that doesn't move, I'm like, I don't want any part of that.
Yeah, so, I mean, it's more of like watching a total knee replacement or something like that is like a carpentry shop. You got the big drills and the saws, and
I have little drills and little saws. It's very similar, actually. I mean, I do a ton with drills and instruments that look. If you take a look at them under the microscope, you're like, I could see this in some kind of tool shed somewhere, but it's just much smaller.
Yeah, I'm fascinated on just how that even happens. Like,
you should come by. I'm always happy to let you watch a surgery. So,
all right, I may take you up on that if I'm not like. I'm just already stressed out just thinking about it. I don't know if I can handle watching you do it in that regards, but man, to each his own, right?
I guess it's what you're used to,
That's right.
Like I said, your fields, those parts of your field stress me out. It's just, you become very comfortable and you get really into what you know and what you're used to.
Yeah, that's how I have a father and brother and other family members in dentistry. And I remember when I was, young and, people, asking, "Are you going to be a dentist?" and things like that. And I remember in elementary school, we had the mechanical pencils where you had to feed the lead, through the tip. And I remember just being like, you get the lead halfway in through the tip, and then it snaps off if you do it at the wrong angle. I remember just making a mental connection of I don't think I want to be a dentist, because I think this is something kind of like dentistry, which it sounds like with your field is that magnified.
It's
literally.
funny. It's funny how you can have those, those thoughts when you were younger, and it's like, oh, that was a turning point for sure. So.
Right. Well, perfect. Well, we're going to take a break here, a word from our sponsor, and then you guys stay on. We're going to be talking specifically about hearing loss and getting into some real practical information on hearing loss, the types of hearing loss, what you can do for it, things to look out for, and different treatment options in regards to hearing loss.
Stay Healthy Knoxville is sponsored by Simply Physio, a physio clinic that equips and empowers you to live your life to the fullest so that you can enjoy the things you love to do and be the person you are made to be. Simply Physio specializes in helping people get back to a healthy and active lifestyle, living free from pain and medication and avoiding unnecessary surgery. Stay tuned until the end of the episode to receive a special gift from Simply Physio and enjoy listening to the rest of the episode.
All right, guys, welcome back to the show. We're going to be diving deep into hearing loss here with Dr. Jameson Mattingly. So, Dr. Mattingly, tell us a little bit about what types of hearing loss there are.
That's a great question, because I think, a lot of people come to the office and they kind of put hearing loss under one blanket, area. And in reality, it can be, there's a lot more nuance to it that really goes into how we talk about treating patients. By far the most common hearing loss that I see is called sensory neurohearing loss. And that's really, hearing loss that originates in the inner ear. And there are a variety of causes of that. As we get older, we have a tendency to lose some of our hearing. I mean, the majority of people greater than 55, 60 years old have some degree of hearing loss. Some of that may not be impactful on their day-to-day communication, but there are more mild degrees of hearing loss in a ton of people. And then there's other things like, noise exposure, whether that be through a job or, recreational stuff, hobbies they have, particularly, shooting guns or, outdoor equipment, ATVs, boats, motorcycles, things like that. And then, some people will have some, kind of unusual hobbies where they'll do, they say that I set up a bunch of fireworks, or they are going to a lot of rock concerts all the time. They're sitting right next to the stage, and that noise exposure can come in a variety of shapes and colors and sizes that can be really detrimental to the hearing if exposed at a loud enough degree or over a longer period of time. And then there's a type of hearing loss called conductive hearing loss, where it's exactly as it sounds. There's something wrong with the sound conducting to the inner ear, and that usually means there's a problem either with the ear canal, the eardrum, or the ear bones. And that's a little bit more important for my specialty day to day, in that that's on average, something that's potentially surgically correctable. And common causes of that can be infections, holes in the eardrums, and fluid on the ears, or things like otosclerosis. And otosclerosis is basically hardening of one of the ear bones. And we can actually sometimes go in and replace those bones and really help people's hearing out a fair amount.
Now, is any of that due to noise exposure?
None of that's due to noise exposure.
Okay.
You, in theory, can have an eardrum rupture because of noise exposure, and that can actually damage both the conductive part of the ear and the inner ear. So you can have a combination. That's the last type of hearing loss, and you fed right into that perfectly. And that a combination of those two is called a mixed hearing loss. And so, people come in a variety, with a variety of different problems with their ear that causes, a mixture of those, whether it's, long-term noise exposure causing inner ear damage, and with a hole in their eardrum that causes some conductive hearing loss as well.
If somebody thinks they may have hearing loss, are there different indications that they would have one over the other?
Not really. I mean, some people have a very solid family history, and that's probably one thing that I failed to mention is genetic components. And it may not be something they experienced till later on in life where they say, oh yeah, I have multiple, family members, brothers and sisters, or mom and dad that have hearing loss. And so, that can be a huge component of what we deal with. But if someone comes and said, I've got a really strong family history of certain disease, that can strongly suggest that's what's going on with them as well. So I would say most part it's very difficult for people to understand, about themselves, which one they could have. If they have really bad ear infections, drainage out of the ear, it's probably a conductive. If they just are noticing some, gradual hearing loss over time as they get older, or they've had previous noise exposure. It's probably sensory neural or any inner ear. But what I've found is, in general, people are really bad judges of their own hearing loss. And, frequently they come to me because a family member points it out to them. Usually a spouse is like, hey, they can't hear me anymore. I need you to take a look at this. I'm going to divorce this guy and, whatever. This is, I don't get examples to quite that extreme, but they joke about that frequently, that their husbands, in particular, have selective hearing and really they just can't hear. I can't always rule out the former, but, sometimes it truly is that.
So I would imagine there's a conception or maybe misconception that hearing loss is a natural kind of state of aging where because, most people would kind of put, things together as far as, that person's older, they have a hearing aid. It's kind of natural because they've gotten older. It's just part of getting older. What would you say to somebody who that's their understanding or belief of just saying it's normal for, somebody that age?
Well, normal, any kind of disease process, I always have a hard time saying it's a normal process, but it is much more common in the, as we get older. The elderly population in particular has a lot of hearing loss. People in the military when they were younger, especially. That's one of the most service-connected, illnesses in our military is things like hearing loss and tinnitus and things like that. And so it can be common, but it's not normal, and it doesn't mean we treat it any differently. Well, there are plenty of people who are children, adolescents, teenagers, early adults who have hearing loss, and my suspicion is that you don't even know it because they do such a good job compensating for it, or they're wearing a hearing aid and you can't even see it. And, especially if they, the hearing aids today are so well camouflaged that for the most part, you may have someone you've been around several times and not even know that it's being treated. So it's really an all age group disease, I take care of basically birth to death of people who have hearing loss, but it's more common in the elderly population.
Sure. Yeah,
for sure.
Similar to kind of what we deal with is it's natural for people to develop arthritis, right?
Absolutely, I'm sure it's very similar.
And but just because you develop arthritis doesn't mean that it's you have to live with back pain, right?
Absolutely.
It's just we got to do a few extra things to keep you loose and limber and strong, but there's ways to combat against it, and it's not just that you have to kind of throw in the towel.
And
right?
I'm sure your field is the same, and every 70-year-old person doesn't have arthritis. But a lot of them do,
sure.
And that's the same way with hearing loss.
Sure.
And your one of the risk factors for it is getting older.
So if somebody, is suspicious that they have some hearing loss, so I imagine the first step is getting a hearing exam. What does that actually look like? The
medical term is an audiogram. Usually if I have someone who has, they're seeing me for hearing loss or there's concern of hearing loss, that's the first thing I do because it's, for me, it's real data, because I can ask 5 different people with hearing loss, and some people say, I don't have any hearing loss. So just going by people's own perception of what they have is difficult. So that audiogram actually puts that on paper and says, hey, in comparison to normal, this is where you hear. And that usually is about a 30-minute, process where you get exposed to, different frequencies, so different tones, and we see where you hear, and we basically place those tones around important, hearing situations for speech and things like that. And then we actually test your ability to recognize speech, the clarity of sound that you have, because, if we get more, as we get into the weeds a little bit, those can be important, whether or not you have good clarity still, how does that correspond to your actually ability to hear tones? And, a frequent thing I'll tell people is that I don't care if you can hear the dog bark or your alarm clock going off. What I really care about is, can you hear speech? And so really a lot of times I'm asking patients how are you performing on a day-to-day basis, talking to your loved ones, your coworkers, whoever. And so that test gives us a little bit of a basic understanding of what's going on with that patient.
Sure. So let's say that shows, right, some hearing loss. And you mentioned to start the conversation that there's different types, right, to really determine kind of what the treatment, options are. So once you determine that there are statistics or just information there from the test, positive information that shows hearing loss, what would be your next kind of step with that then?
Usually it's talking to the patient. One of the really critical components of all this is that I work with audiologists. They're really actually, they're very much hearing experts. A big part of what they do is dealing with hearing testing and fitting hearing aids. And so really working with them tightly about what their concerns are And, a lot of times if they have certain levels of hearing loss, they don't necessarily need to see me. They can talk to the audiologist alone and say, this is very consistent with your age and your history. I recommend a hearing aid. I recommend this. But if they're seeing me for that as well, I'm really, really going deeply into what are the possible causes. I take their age into account, their history, whether that's noise exposure, genetics. Have they been exposed to certain medications that can cause hearing loss? And, do a physical exam where I actually look at the ear and say, is all this making sense together? Is there anything else I'm not considering? Are there any medical conditions that I need to be worried about that I need to test for further that can be impactful for other reasons? And so it's kind of that whole combination of the hearing test, talking to them, and actually taking a look at their ear and making sure that all this fits together nicely.
Are there common medical conditions or somewhat common that you see that affect hearing?
Yeah. So, outside of the age-related hearing loss, anybody who has a conductive component to their hearing loss, that hearing loss that is part of the conductive apparatus of the ear, really I'm looking to see, have they had infections? Is their physical exam normal? Do they have fluid? Stuff like that potentially is medically or surgically reversible or fixable. And then, a lot of times they'll have asymmetry in their hearing. So one ear is different than the other. And that's important because, occasionally you can have things like benign growths on the hearing and balance nerve or other things like that we need to do more investigations, like some kind of x-ray on the head or such as like an MRI, and make sure we're not ruling anything that could be medically impactful to them just based upon their hearing. I mean, that's basically a neurological symptom, hearing loss. And so I'm really just trying to say, does all this make sense? Do I need to do anything more to get the full kind of picture?
What kind of consequences do you typically see for someone suffering from hearing loss?
Yeah, there's been a lot of really good research over the last 10 or 15 years that really addressing this. And we do know that there is a correlation between hearing loss and social isolation. So people not wanting to go out in public because they can't hear very well. They don't, they're frustrated by, having to say what frequently or having other people repeat themselves. And, we know that that's actually linked to things like depression and anxiety. Now, is one causing the other? It's hard to know. We just know there's a really strong link between those two. And then more recently, we've actually found out there's a significant link to hearing loss and dementia. And for a long time, I think that there was a lot of clues that those could be tied together, but there was a lot of other factors like cardiovascular health, like things like, are there arteries part of this, like high blood pressure, diabetes? But in reality, what we found is that it's an independent risk factor for dementia. And the more hearing loss that you have, the more that goes up. So if someone has severe hearing loss, which is very, impactful in their day-to-day life, it can have up to a 5, maybe even more, 5 times or even more risk of developing dementia. And as we all know, dementia is something that no one wants. I mean, it can be devastating for families and patients. And so we know that that's at least an independent risk factor for dementia. And that's a reason why we do recommend things like hearing aids and anything we can do to rehabilitate the hearing.
So getting into treatments for hearing loss. So, we've already mentioned a little bit about, hearing aids. And that's really what an audiologist is primary. That's their kind of what they do.
That's big. They're a big part of their expertise. And they do several things, but I would say talking about hearing aids is really, that's something that they are very much experts on.
And then, so going from there, other treatment options for hearing loss.
Yeah, so it depends upon the cause. I would say the most common thing is we do nothing. We observe it. If they have some very mild hearing loss, or give hearing aids for especially people who don't have anything that we feel is correctable. And then there are a variety of surgeries and implants and things like that that really are dictated by what the patient has going on. So if they have an ear bone that's a problem, sometimes we can replace that and fix it. If it's a hole in the eardrum, we can repair it. If there's chronic infections or fluid, we can get rid of that, and there's a lot of different ways to go about doing that. And then there are certain implants, some that actually bypass the eardrum and ear bone. Those are called bone conduction implants. And then in this, in people with severe to profound or even a little bit less, even less severe hearing loss than that, we can do things like a cochlear implant. And so we really have a lot of tools at our use that we can actually use to, have people interact and communicate better on a day-to-day basis.
Sure. Well, tell us a little bit more about the cochlear implants. And it's a I think a term that probably people have maybe heard before, but yeah, tell us a little bit more about what that means, what it does.
Yeah, absolutely. Cochlear implants are something that are near and dear to any otologist or neurotologist heart. It's something that we really are huge advocates for, because we're really taking a population of people who really struggle from a job and a social standpoint, and many aspects of their life, and we can actually get them back to a better functioning self. And really, I think any physician, but particularly me, that's what I'm after. How can we make you function in your day-to-day life better? And cochlear implants are really kind of the end game for some of the most severe kinds of hearing loss. And what it is an electrical device that we implant surgically. And what it does is it bypasses the most common areas of injury of the inner ear. The inner ear structure that's responsible for hearing is called the cochlea. And that's frequently has a lot of injury to it from noise, genetics, whatever, age, tons of different reasons for you to have injury there. And we basically bypass that injury and we stimulate the hearing nerve directly. It's a lot different than your normal hearing, or the hearing you were born with, because your brain basically has to adapt to it. It's not normal hearing, but it's much improved to what some of these people are used to. And it takes them from potentially not being able to use the phone to using the phone. It takes them where they can continue to work. And we don't know this 100%, but hopefully it can help, decrease the risk of things like dementia, or these long-term health consequences of not being able to hear.
So with a cochlear implant, so that would be a treatment for somebody that wouldn't be needed for somebody with just hearing loss that a hearing aid would fix. Like a hearing aid, does that just amplify the sound?
That's a really great question. So when we have people with hearing loss, one of the things I'm looking for is, do they have clarity of sound still, clarity of speech? And a hearing aid does a really good job on someone who has preserved clarity of speech, and they just really need volume. And hearing aids are more advanced in just giving strictly volume. They're giving volume where it's needed that we actually see on their hearing tests, where they may have a high frequency or low frequency hearing loss, and we're actually amplifying that. So they're more complex than that. They can have Bluetooth capability where they can actually go to their phone, so their signal to noise is what we call it, is higher, so they do better. But once you get to a point of certain damage to the ear, the clarity goes away. And hearing aids, all they do in that scenario is potentially amplify noise. And that can be super frustrating, because they're like, I hear stuff, but it doesn't make any sense. And that's kind of the thing I'm getting after, is how are you doing with your hearing aids? If they're struggling with their hearing aids, then we say, are you someone who would benefit from a cochlear implant? Because in certain patients, or many of those patients, a cochlear implant can restore a part of that clarity where they can actually communicate more effectively on their day-to-day basis. It's a really long conversation. We spend a lot of time with these patients to help them understand, what does a cochlear implant mean? What can I expect? Who is it good for? Because it may not be good for somebody. We really take our time to make sure that we are making decisions regarding this. We're taking the time that's needed. And one of the things that we know, that we're really concentrating on, is that we're only getting about probably 5 to 10% of the people who could benefit from a cochlear implant actually get one. And it's similar to that for hearing aids. So we have a huge portion of the population that are going untreated from a hearing loss perspective. That's just a very small percentage of people we're actually getting to. And my job really is podcasts like this, is trying to advocate, market, get these things out there, say, hey, there are options for people with hearing loss who are struggling that can be hearing aids only, maybe a cochlear implant, maybe something else, but there are options. And I just really want to make sure we're targeting as a big percentage of those patients as we can.
Sure. Last question that really goes over hearing and how it interrelates to hearing is tinnitus. And you mentioned that, I think, earlier just in conversation just a bit. Yeah, tell us a little bit, maybe just overview of what that is and how it affects hearing and what you do for that. Yeah,
tinnitus is something that is very frustrating from both a patient and my perspective, because there just aren't a lot of treatments out there that are super effective. But tinnitus is really the perception of a sound when none is present. And it can be described in a lot of different ways. Ringing is probably the most common cause, but people will say, oh, it sounds like an ocean, or it sounds like crickets, or it sounds like a rumbling. Those are all kind of the same thing. And we don't exactly understand it perfectly well, but we do think that there's some injury into the ear that causes the kind of communication pathway between the ear and the brain to be reorganized or become dysfunctional. And then there's the perception of ringing after that. And, there's no real easy cure for that. There's really, there's only a lot of ways that we help cope with it or diminish the actual tinnitus. And the thing that we see most commonly with tinnitus is hearing loss. And so, when there's damage to the ear, it usually causes hearing loss and potentially tinnitus to some degree. For most people, just monitoring it, observing it is the right treatment because they're not bothered by it. It's not making them anxious or depressed. It's annoying to them, but when they're busy, they're working, they don't notice it. When they sit down at night, when it's quiet or they're going to sleep, that's when they perceive it. But otherwise, it doesn't bother them. There's a smaller percentage of patients that it actually does bother them a fair amount, where it does interfere with their communication. It can potentially cause depression, anxiety, and more than anything, a decreased quality of life. And that's when we're really a little bit more intense about doing things like hearing aids, because hearing aids actually will help mask or actually decrease the perception of tinnitus. There are certain triggers that we know that can make it worse, like caffeine, stress, sleep, and things like that. We try to do lifestyle things to really help these things, help people perceive their tinnitus as less. And there's all kinds of different noise and masking therapy, and then that are moderately successful. And then really the only thing that's really heavily supported by our academy is cognitive behavioral therapy. And those are for people who are really disturbed by their tinnitus. And that's really where my concentration is. When people see me for tinnitus, is like, where are you on that? Where are you super stressed by this? Are you anxious, depressed, or are you not? Because that will help me figure out if I need to intensify therapy in some way or not.
Yeah, I mean, that's something we see some here in the clinic too, and it's similar conversation of like, hey, listen, there's a lot on we don't know about it, but oftentimes we'll see some whether stress, anxiety, and muscle tension, movement movement dysfunction related on that, and we have to just explain like, hey, we're seeing things that aren't even. So our strategy is let's work on evening this out, reducing tension and stress around the muscles that can refer symptoms to the ear, and then track your progress. Right?
Yeah, people. Which is a great point. I mean, physical therapy, I think, is a critical part of that for many people, because if they're holding muscular tension in their jaw or their head, otherwise, we know that can change or alter the perception of tinnitus, and it makes a lot of sense that if we can help diminish that, it would either have less stress in their life or actually potentially alter the tinnitus. So I'm sure you see that a fair amount too, and I'm sure you've had a lot of success with it. And honestly, I think it's an underutilized portion of what we do.
Sure. Awesome. Well, yeah, thanks for diving deep into hearing loss here today. We always like to end the show, and I know we were chatting a little bit beforehand. Since you're new to the area, it'd be interesting to see how we finish these last few questions. Most of my guests have been here for more than 7 or 8 weeks, but we always like to finish with a few rapid fire questions. So, Dr. Mattingly, tell us something that's on your bucket list to do. You probably have a big bucket list around Knoxville since you're new to the area, but something you love to go do when you have some free time to explore.
Yeah, definitely. My wife and my son and I, we want to get involved more into some of the water in the area. Maybe go in the mountains and canoe, kayak, or whitewater raft or something like that, because we love being in that area. Yeah. And then the one thing that I was thinking of actually is that there's all this water around us and I haven't been on it yet, or, and at some point I'd like to get, rent a boat or something and go out. I'm not sure, just some way to get out there and enjoy, because I grew up going to the lake a bunch, and this is beautiful to be in an area like this. So,
well, one thing we're planning on doing when it gets a little bit warmer, which not sure if you heard about it, it'd be an easy trip to be in the mountains on the river, is go up to Townsend and you can float the little river, is it Pigeon? Little river. And you have inner tubes, and companies you can rent an inner tube for like $10.
Perfect.
Float down. So perfect for a young kid and families.
Just let me know and we'll be there.
Yeah.
I promise.
So what's one of your favorite places to enjoy outside around Knoxville that you have had a chance to enjoy?
We go to a lot of parks because we have a young child. We like to go and visit all those areas, but anywhere where we can look out over the water. And then really a couple hikes we've been on so far in the Smokies. We've really enjoyed those. One of the ones we went most recently was Rainbow Falls. Okay. And it was the traffic was pretty heavy, but it was beautiful seeing all the water and hearing the water and just getting out and getting some exercise and stuff like that. Those are where we are at our best. My family and I just love being out in those environments.
Nice. Favorite restaurant here around Knoxville?
That's a great question. Favorite restaurant? Well, we go to the Lakeside Tavern a fair amount because we live very close to it, and it's nice to just look over to the water and have a nice little meal and just relax. And so as of right now, that's it. I'm sure that will change over time, but so far so good with it. We really enjoy going there. So
nice. Well, what can you leave our listeners with as far as your best tip or recommendation for staying healthy in regards to hearing loss?
Yeah, if you limit your noise exposure as much as possible, and when you are around loud noises, use hearing protection, whether that be earplugs or earmuffs. And if you read into the packaging of a lot of those, they'll actually tell you what it's good for, and if it's inadequate sound protection. And really, I'm talking about things that like shooting firearms and hunting and things like that, or anything along that's roughly equivalent to that. So anything that you feel like it's just too loud, wear hearing protection. And then if you have a problem, whether it's new ringing, new hearing loss, new dizziness, give us a call. We're always going to check you out and make sure everything looks good.
Well, and that was the last question. So how can people get in contact with you?
Yeah, so our group is primarily out of the Park West Hospital, and our main office is at that hospital. We have a couple other offices downtown in Lenore City, and you can call our office at 865-693-6065, and we'll take care of you. We have a wonderful group of physicians and audiologists and staff that can really do a good job of making sure we're getting to the bottom of what's ever going on with you.
Awesome. Well, thank you again for coming on the show.
I appreciate you having me. This is always great to get to know people and talk about things that are near and dear to my heart. I'm a little bit, obviously people are going to be like, oh, he's a big nerd because of that, but I'll take it. So my partners are definitely going to say that. They're like, oh, you ear nerds, So that's definitely, that's something that's very important to me, obviously.
Well, we're glad that we have nerds in different areas
Yes.
of what they are so that we can enjoy when we, gathering, whether help when we need help in those areas. So thanks again for coming on the show, and stay healthy, Knoxville.
Thank you for tuning in to the Stay Healthy Knoxville podcast, brought to you by Simply Physio. If your pain is preventing you from staying healthy and active, and you'd like to avoid surgery, pain medicine, or just want to get back to doing the things you love in and around Knoxville, we offer both a free ebook and free over-the-phone consultation to help you figure out the root cause of your pain and the next best steps for resolving it. Find our ebooks online at simplypt.com/health-tips. There you will find ebooks for topics such as neck and shoulder pain, lower back and hip pain, knee pain, and TMJ. These quick-to-read reports will provide you with expert tips, tricks, and exercises to help solve your pain from the comfort of your own home. Just visit simplypt.com/health-tips to download your ebook and have it delivered directly to your inbox. We also offer free, no-obligation phone consultations with a doctor of physical therapy to Knoxville area residents. Just call us at 865-351-0615 or visit us at simplypt.com and click the Talk to a PT button on the home page to schedule a call with us. Thanks again for joining us, and we will see you next time on the Stay Healthy Knoxville podcast.